Well, it's funny. I've always wanted to be a physician. I've never wanted to be anything else. I'm not one of these people that wanted to do one thing and then moved on to another. I've always wanted to be a physician. And although it's a little bit corny sounding, I've always enjoyed talking to people and trying to help people. And I've always enjoyed the detective work involved with medicine. And then lastly, the enjoyment of seeing people get better when you institute the treatment. I've been with BGA for about 14 years. Working with 14 different physicians is really a great benefit. I have 13 partners that I can readily engage in, and I have instant consultative services. Imagine the experience that 13 different physicians have and the numbers of years and the numbers of patients they've seen. So the great amount of experience that they have that I can tap into. So I have instant consultative services. And so we have some of our physicians who concentrate on liver disease, some who concentrate on and have special interest and knowledge in inflammatory bowel disease. And then I have a special interest area in diseases of the bile duct and the pancreas. And therefore, I get a lot of referrals to my practice for specialty problems of the bile duct and the pancreas. Also, the other physicians in the group consult me often, and we talk about difficult issues or problem areas when patients present to them with problems of the pancreas and the bile duct. I enjoy being in that specialty area, and there's some specialty endoscopy that goes along with examining and evaluating those areas. It's the patient explaining to the physician what they're feeling, but it's also the physician listening carefully and asking a few pointed questions to get the information that's necessary. And so often patients will say to me, I'm not sure that I'm explaining this really well. And what I say to them is, you're doing fine. What I really need to know is what you feel. Many times patients will say to me, well, my sister said I have this, or my doctor said I did this. And I stop them and I say, no, I don't want to know what your sister feels or what your doctor feels. I want to know what you're feeling. What you're feeling is what I want to learn from you. And most of the time, if you just listen to the patient, they'll tell you what the issue is.